common sense is that we should be using fixed movables. And we'll talk a lot about fixed movables today. Fixed movables are our ideal design for posterior bridge work. So it takes the stress off individual cement loops. Remember, your bridge going in place is not just a bridge going in place now, it's an expensive piece of jewellery that's going to go into the patient's mouth that needs looking after. So what should be your oral hygiene recall for these patients who have expensive pieces of jewellery in their mouths?
3 monthly.
3 monthly, so that's just standard, 3 monthly. So everybody who's going to have some expensive jewellery in their mouth gets a 3 monthly recall with the hygienist. Okay, and it's not just a scale and polish. What else can we be doing at 3 monthly? We can be fluoriding, we can be putting fluoride around, painting fluoride around those margins every single time we see them. Okay, and beefing up the resistance to caries on those root surfaces, those margins, every single time. So if I'm going to have a weak abutment, what sort of bridge do I want? I want a bridge that takes the stress off the cement loops. Therefore, I'd rather go for fixed movable. We're not talking about how you handle patients, whether it's right to take a tooth out or not. We're just talking purely, you need to know what is the best bridge success you can possibly get. And what I'm saying to you is you'll get a better long-term bridge success by sacrificing the laterals now and going to a 6-unit bridge on the canines. If you just use the laterals now, you might get 5-7 years out of it, or 10 years. Or it might work, because some of them do. But all we're doing is we're playing the percentages, we're being the bookie. Okay, that's all we're doing at the moment. And with bridge design, that's all you really need to be aware of, is playing the percentages. Let's go on a betting spree. Okay, and which is going to be a better bet in terms of longevity of the bridge. And of course, in terms of that, you have to go and say to the patient, you know, will you accept me taking 1 tooth or 2 teeth out? Answer is no. Okay, we can't give you a good longevity to this bridge.